So today we're going to talk about what an aging life care professional is and how we engage in partnering with our clients for providing care as well as advocacy. So what is an aging life care manager or professional? We go by both names. Some of you may know us previously as geriatric care managers, and some of us just call ourselves care managers. So we have a variety of names. But typically our background is in social work, nursing, gerontology, or other health.
No. Okay.
Could everyone mute, please? Because someone's speaking and we can hear over. Thank you. And we're also other general health and mental health professionals. So we do have some occupational therapists, physical therapists, for example, who have transitioned into this profession. And so we have essentially specialized training and experience with community resources in the area of aging. There are some aging life care professionals or aging life care managers who specialize in mental illness. And so some of us may have much younger clients than others. But the majority of us work with people who are 65 and older. Because aging life care professionals and aging life care managers is a trademarked profession through the Aging Life Care Association, and we are all have to be members of that to be able to use those professional designations. We also have to follow a strict code of ethics and standards of practice. Now, there are geriatric care managers, there are care managers out there who are not part of the Aging Life Care Association. They may belong to some other organizations, but if you are looking for somebody, and we'll go over what to look for a little bit later in the slide, it is important to find out if they are operating on their own completely, or they're operating under the guise of some sort of code of ethics or standard of practice, whether that's through the Aging Life Care Association or Care Management Association of America or anything like that. So that's an important thing to keep in mind. Care managers in general, at least in California or in San Diego, charge anywhere from $100 an hour to $250 an hour. That hourly rate varies greatly depending on what state and what city the care manager is working in. And we do have care managers in all and across the United States and including Canada at this point, as far as the Aging Life Care Association is concerned. So what does an aging life care manager or professional do? So our main two or tasks are really to provide peace of mind, and that's peace of mind to the aging adult and their support system. So knowing that you have a backup person, you have somebody who's going to answer the phone during those emergency situations, who's going to be there to either actually boots on the ground, work you through a process, or guide you, depending on how you work with your aging life care manager, help you to get through any crisis, but more importantly, to prevent crisis, to get things in place to help address issues in order to prevent any kind of crisis. And we're also there to increase quality of life. You'll probably hear me say numerous times during this presentation that we really are person-centered and we provide person-centered care. So our goal is to really follow what the 4 M's that of aging, which is what matters. So what matters to the person, mentation, where are they mentally, what is their mobility, and what does their medication look like? And so we want to look at all of those things to improve quality of life, to make sure that we are meeting the person where they are, that we are addressing what their needs are, what their desires are, and really giving them a sense of quality. Our motto at Aging Focused, the company that I own, is we want to leave the client in a better place than when we arrived. So how does an aging care professional help? What do they do? We essentially have 4 main job components, and here we have 3 of them. And the first one is professional support. So assessing the needs, developing a care plan, linking clients to services, mediating any conflicts, and crisis intervention. So this is really the assessment and putting everything together phase. It's getting to know the individual that we're working with and their support system. Once we get a plan into place, we've got some things in that person's life moving for them, whether that's attending doctor's appointments or finding new doctors or finding placement in assisted living or memory care, for example, or it's getting caregivers or arranging for home physical therapy, you name it. Once we do that, we're monitoring the client and we're monitoring those resources that we've implemented. So we want to make sure that the needs and the goals are being met. We identify any changes that need to be made and we make those adjustments accordingly. And we continue to keep everybody in the loop informed. So whether that's the individual person that we're working with, the family members, the power of attorneys, any key professionals that need to know what is going on with that person, we're kind of the central communication hub and really informing everybody of what's going on. This again leads to peace of mind for the family. They know they have a go-to person when there's an issue. And I always tell clients, we do the heavy lifting. Like we're there to do the heavy lifting. So you as a family member can continue to perform in that role. So the spouse can continue to be a spouse, the daughter or son can continue to be a daughter or son, etc. Let us do the heavy lifting and monitoring and making adjustments. And we are always completing ongoing evaluations and adjustments of the plan because this is life, right? Like we don't just put in a plan and that's the plan ongoing for, as long as that person lives. Things change, medications change, falls happen, infections happen, family members visit, you name it, things change in our life all the time. And we want to make sure that our plan is flexible enough to meet the changing needs of the people that we work with. And we're constantly coordinating care. So we're trying to find the best options for that client situation, making sure that we're finding the right match for them in any situation. We're always communicating, advocating, educating, and we want to make sure that the quality of the care that we are implementing is effective and it's meeting the goals at all time. And then we are there to help if any new problems arise. Like I said, this is a fluid process and we're constantly working towards making adjustments as necessary. One of the main jobs that we have and one of the things that we work toward constantly is advocacy and education. So because we're a person-centered program, our advocacy and education is geared towards advocating and educating the client, or advocating for and educating the client. So this could mean anything from helping them to understand what their diagnosis means, how that impacts their daily lives, but it also helps, or it also means we'll be advocating to others on their behalf. So for example, someone who has dementia and maybe is not remembering how to keep appointments anymore, we're putting in we're putting in procedures and supports for that person to manage that. And so we might be educating them on a new process, but we might also be advocating to physicians or families and letting them know why this person has missed appointments in the past and that this is the new procedure that we're following in order to make those adjustments. That's just, one example of many things that we do to educate and advocate. But we're also doing that with the family and the support system. So helping them to understand this is the person's new normal, this is where they're at, these are the things that will work for this person, this is what you can expect to happen as we move forward in any illness or injury situation, and really helping them to understand where our client is at that moment, where they're moving, but also advocating for that client to that support system, but and also advocating for the support system, helping them to learn how to navigate their new role in their loved one's life and how to manage some of the difficulties that they're going to face. I had a spouse of a client of mine this week that I sat down for a coaching session with, and that appointment was really all about her and how she can change her process of communicating with her husband in a way that is, one, going to save her a lot of frustration, but two, hopefully make better connections with him, so that he's understanding what's happening. So again, the family support system is a huge part of our dynamic, but it's, again, the client themselves is the center of why we do all this. We're also advocating and educating the medical community, legal and financial communities as well. So these, I'm going to be showing you a slide in a couple minutes that shows what our knowledge expert areas are. And lots of times we're doing a great deal of community education and advocacy to those people, those other professionals that work with our clients and work with us in this shared space of aging life care in general. And then we're doing education advocacy programs to the general community. This is a perfect example of one, helping community members, people who are maybe planning for the future, know what we do and know what is important to move forward in their planning process, and or just to build what I call your toolkit for the future, knowing what services are out there to help you when and if you get into a situation where you need to have a care manager present in your life. So essentially, we advocate and or educate anyone that is in the life sphere of our individual clients and beyond. And here's that wheel of knowledge areas that I was talking about just a minute ago. So these are the 8 Aging Life Care Association knowledge areas. So we have, I want to point out that when it comes to legal, financial, and health and disability, we are not actually the practitioners of those spheres. So we're not attorneys, we're not financial planners, we're not physicians or nurse practitioners or PAs, but what we do have a knowledge in is, what do you need in those areas of life? What do you need legally as you age? What kind of legal documents are important for you to have completed or search or complete if you haven't already? What financial support systems are there for you? And that's not just who the payers are, but how do you develop your financial power of attorney? Where do you go to get support for caring for your finances as you age, et cetera? And then, of course, health and disability. What are the services that are available in the medical arena to help you? Who is a good geriatrician, for example? Who is a good cardiologist? Who works well with physical therapy or home health and so forth? So we know the resources for those things. And the same thing with housing. Like, I'm not going to house somebody, obviously, but I'm going to know, assisted livings in the community, memory cares, independent, skilled nursing, what works best for that person and what meets their individual needs. Because we have some amazing assisted living and memory care communities in San Diego, but not all of them are the right fit for everybody. So knowing our clients and knowing communities is something that aging life care professionals know about and know well, so that we can help make one placement instead of, unfortunately, some people go to the wrong place and then have to move, and that's just disruptive for everybody. But we are always, as far as the other 4 areas are concerned, we know the local resources. We're very up to date on that. We're very involved in family mediation, avoiding family crisis, advocacy and education, like I just explained, and then crisis intervention. So one of our key components is setting up those care plans, putting things in place so that we can minimize the risk of falls. We can minimize the risk of medication errors. We can minimize the risk of somebody becoming a victim to a scam or a predator of some sort. And also just, again, getting back to that quality of life and putting things in place for that person that also assist with, decreased depression, decreased, mental health issues. So we're really working at all times to make that life better for our client and their family. So here are some red flags that we let consumers know that might start to get you thinking about hiring a care manager or care professional. Has the person been diagnosed with memory loss? Is it dementia? Is it mild cognitive impairment? Are you just noticing that they have memory loss and maybe they're resistant and you need someone to do an assessment and then help guide you to the next steps with your physicians or a neurologist, for example? Is the person refusing help? I can't, I did an assessment earlier this week with a couple who just refused help with anything because they're so fearful that they're going to be taken away from each other, which I found interesting, but also being taken away from their home. And the daughter, through much effort on her part, finally got them to talk to me. And sometimes it just takes someone outside of the family to explain to them what's going on and what they need. And we are now working on a plan for them to stay at home together and have supported services around them, which is going to help with everything from, their nutrition to their transportation to their bathing and showering needs. They were in pretty bad shape because they were fearful of anyone discovering just how much help they really needed. If you just feel you need an advocate, you're not getting anywhere with your physicians, you're not getting anywhere with the community that you're living in, and you need someone to come in and help advocate for you. You're confused about your options. What's the difference between assisted living and memory care? When is it the right time? What's the difference between home care and home health? I can't tell you the number of times I have clients saying to me, oh, Medicare says they're going to pay for caregiving. No, they're not. That's not what home health means. Home health means you've been discharged from the hospital and you have been referred to home health, which means physical therapy or occupational therapy, maybe a nurse visit once a week, but it's not going to be caregiving. These people aren't going to be cooking meals for you and helping you get dressed and take care of you. They're going to come in to do physical therapy and that's it. But there's a lot of stuff that people just don't know about because they haven't been there yet. We do this every day, so we know those resources. You're two other areas, you're entering into some type of crisis of some sort. And crisis can be reoccurring falls, it could be reoccurring UTIs, it could be, your loved one or you, for that matter, have gotten lost. You just see that there's some writing on the wall that we're going to be in deep trouble soon if we don't have some sort of intervention. And then family conflict. We, as care managers, we are all skilled in helping families resolve conflict. Sometimes conflicts get to the point that we need to have greater intervention. And so some of us, like myself, are trained in family mediation. I did a family mediation just a couple of weeks ago where the family just could not agree on next steps for their mother. One person wanted one thing, another person wanted another thing, and then two felt that they agreed, so therefore that should be the option. And we talked about it. I facilitated mediation with them over a 2-hour period, and we were able to come up with an actual agreement, and they were all happy moving forward. I just checked on them a couple of days ago, 2 weeks after our mediation, and everything is working smoothly. So sometimes we just need someone to be that objective person in the room who's going to listen to all sides and help our family get to where they need to be. So here are some other things, other reasons to get a care manager. You just basically need information. Things are going beyond your expertise and you need help you'd want to know about community services. You or your family has little or no local support. This is a big one. We have a huge population of older adults now who have been called everything from solo agers to elder orphans, both terms of which I don't like. And I think we need to come up with something that sounds less ageist and more meaningful. But they may not have children in the area. They may not have ever been married, or they are now widowed or divorced, and they don't have a support system around them or a safety net around them, and they need to have that local support there. You feel again like you need some advocacy because you and your family keep falling through the cracks. You're not getting your needs met through your healthcare system. You need unbiased information like the mediation. You need that person in the room who's going to be objective and isn't part of the family dynamic to say, this is really what this looks like for you going forward. And these are the options that you have. And again, the disagreeing with next steps. And caregiver burden. The caregiver feels overwhelmed. This is a very real thing. I see this happen all the time with my couple clients where one spouse is doing all the heavy lifting and their life has changed from husband or wife to full-time caregiver. And so they've lost themselves and their spouse in the process, especially when it comes to dementia. And so we want to make sure that the well spouse isn't so overburdened that they start to have health problems and issues, and that they have the respite that they need, that they have the support that they need. A few months ago, I was working with a couple on our caseload, and the wife just broke down in tears and said to me, Rebecca, I should have known this. I've been married to my husband for over 50 years, and I should have known that this is what he was experiencing. And my advice to her was, no, this is your first rodeo with dementia. You shouldn't have known that. How would you have known that? When you said your vows, you did not say in sickness and in health, and by the way, I know everything about dementia, so I'm fine, right? Life changes, and we need to have that support sometimes, especially when we are caring for someone who is suffering from dementia or any chronic illness, where we just need to have a break sometimes, and we need to have coaching and supportive services for our new role. Again, with people who maybe don't have support locally, some families need to have oversight of existing care. And for that matter, even families who are local need oversight in existing care. I've had families who go through caregiver after caregiver and they don't know what the reason is. And they've stayed with a bad caregiver for a long time because they don't know how to fire that person, or they're afraid to do that. Those are things that we do. Again, we come in and do the heavy lifting. We help to manage the situation and make your life easier. And then finally, or not finally, but one other option, because there's lots of reasons we come in to work with families, but if there's any abuse, neglect, or exploitation of a loved ones or ourselves, and we need to have somebody come in and start to be a gatekeeper. This is a really important area that we work in, because we want to make sure that people are not being abused either financially, physically, mentally, or emotionally, and that we want to make sure that our loved ones are treated with dignity at all times. All right, so really what we do constantly is we are on a trying to balance safety and autonomy. We want our clients to be safe, and we're looking at techniques, resources, methods, durable medical equipment, you name it, to keep them safe. But we always want to make sure that we're not doing it to them, that we're doing it for them, and that they're on board with it. I always ask my clients, no matter what their level of capacity is, if they have a preference. And if they can state a preference to us, if they can tell us what it is that they need and want, and we can work around that in a safe environment, we absolutely will. Again, that's part of that quality of life, and treating someone with dignity and respect at all times. Yes, we want to keep them safe, but we still want them to be able to live. All right, so this is, I'm going to try to do this. So this is the Aging Life Care Association. I invite all of you, this is the website here. I'm going to switch off from the PowerPoint, hopefully successfully, and move to that website just because I want to, and hopefully I can't see it at the moment. Let's see if I can move this. Oh, yes, there we go. I have to move everything around a little bit in my screen so I can see. So this is the Aging Life Care Association.
We aren't able to see it on our
Oh, you're
end.
not? Okay, let me share it. Sorry about that. I pulled it up, but then I didn't share it with you. Here we go. Thank you for letting me know. Can you see it now?
Yes, thank you.
Okay, perfect. So this is the Aging Life Care Association. Oh, that tab. And in this tab, you can read all about what aging life care managers are, what we do, and so forth, a little bit about what I talked about, the different designations of aging life care managers. But this is what's important, this Find an Aging Life Care Manager button. This is a great tool because, again, not all of you who are on this Zoom meeting today are seeking help for somebody in San Diego. You might be seeking help for somebody else in another state, or maybe, you know, you are on this Zoom and you need help in San Diego, but you need, you know, your daughter or son or another family member to find the right person in San Diego to work for you. So I'm just going to put in my zip code right here, or a zip code near me. You can put in a zip code. It's as easy as that. You hit the search filter, and what it will do is it will bring up, cycling still, it will bring up care managers within that zip code area, and you can put in 25-mile radius all the way up to 100-mile radius. There I am. But it'll also bring up other people. So you can scroll through and see what the credentials are of the different care managers in your area, where they're located. You can check out their websites. You can even give them a call and ask information, see what they look like, all kinds of things, see what their services are, and so forth. So this is a really good tool to find somebody that you need. And not everybody, unfortunately, has pictures, and not that everyone, I don't think, chooses based on looks, but I don't know, you might. So lots of folks out here. And there also are, so advanced, you'll see here that advanced professionals versus professionals, that's really just number of years in the industry. That's really how the difference between those. And like I said, there's a tab under this, what is a life care manager, where you can read how those designations are made. But let's just go in and see, I'm just gonna put 87114 because that is a zip code. That's where I grew up in New Mexico. And I just know that because that's my sister's zip code. And again, we can search, come on, search. Okay, what happened? There we go. I'm too fast for it. So here we see some other people. This is in the New Mexico area, so Albuquerque, New Mexico. Here are some folks that work and live out there. Susan, by the way, is amazing. So just different people, and so is Nancy. So some good folks out there. And that's another thing too. I mean, if you are here in San Diego, you're local, and you say, hey, Rebecca, I need to find an aging life care expert in, you know, the Boston area. And I looked on the site and it gave me like 5 people, but I can't tell from them who's good and who's not good. You know, give me a call. You guys have my information. They have it at the Retiree Association group there. I'm happy to tell you who I know and who I've worked with in the past, as is any of our colleagues. I mean, that's one thing about our association is we know each other. There are over, I think we're up to, in our association, about 1,300 care managers that are part of our association. In fact, we just had our national conference here in San Diego last weekend. And we get to know each other. We refer to one another. We can help people select the care manager based on their needs. And again, so that's just another way that we work to assist people. So I am going to, if I can find all my various screens again, I'm going to stop sharing this one and go back to the PowerPoint. And we'll continue with this discussion. All right. So here's how you choose someone. Go onto the website, but also, oops, look at, are they a member of ALCA or a member of some other organization that has the standards of practice and ethics? Are they certified? Certified means that we have gone through and taken one of various tests and have to maintain current continuing education, which means we're more resourceful. We have more up-to-date knowledge. We are working constantly within our craft and within our profession to improve ourselves. Is somebody a certified fellow, meaning have they maintained their membership in one of these organizations that creates a longevity or again, that dedication to the profession that's helped them to grow. Some states require licensing, others don't. California does not, but do we have certifications? Do we have an active business license? Are we working for somebody who has, are we carrying the insurances that we need to carry? Those sorts of things. Are we responsive? A good way to test that is when you made your initial call, how long did it take us to get back to you? If we said we were going to email something to you, did we do that? Did we follow up with a follow-up call? Those sorts of things. What is our response time? What is our policy for that? Do we take calls on weekends or after hours? All of those things are important. How many years of experience do we have? Or are we working under someone who has years of experience? So my team, for example, I have 3 care managers who work for me. They all have under 2 years of experience, but I have 30. And I work in teams with them. They are never left alone. I'm always available to them. And actually, in my practice, we work in teams. But again, some of those pictures that I showed you, or those care managers, that advanced professional obviously has many years of experience, but there might be an associate care manager who has room on their care list, and they may be your primary person, but is that advanced professional the backup person or their go-to person? And in most cases, you'll find that the answer to that is yes. Are they knowledgeable about the local area or the area that you work, that your loved one is in? And then what services do they provide? Are they care management? Are they crisis intervention? Do they do placement? Do they do advocacy work? What do they do? Mediation? Look at what services are provided and what you might need. And then finally, of course, what are their fees? How do they bill you? What is it that you're able to do? So some important stuff there for care managers. And again, there are 4 accepted certifications in the Aging Life Care Professionals. Not everybody has all of these, but some of us have at least a couple of them. The CMC is a care manager certified, and this is a certification that's done through Aging Life Care Association themselves. But there's also the CCM, which is a certified case manager. And then the last 2 are social work care certifications, which I honestly do not know a whole lot about because I'm not a social worker. And a nurse would not have those either. But those of us who are not social workers more than likely have a CCM or CCM. And the certification just basically provides assurance of our knowledge area and the fact that we are continuing to work on our skills at all times and learning learning our craft, learning our profession. Where are we on time? All right. And I think, well, why is my screen not moving? There we go. So I went through that quickly because I have found in my experience of doing this presentation in the past is we always have a lot of questions. And I can go back to any of these areas and explain more. I can go back onto the website and search around and show you some additional things, but I did want to open it up to questions.
Thank you so much, Rebecca. That was really useful information. We did have a few questions in the chat. I think you reviewed some of it, but if you wouldn't mind just going over once more. The first one was, how do you work with solo agers? I think you answered that a bit, but could you expand on that once more?
Sure. So solo agers are the people who, again, family members live away, they didn't have a family, maybe a spouse has passed away, or they never got married, never had children. There's all kinds of scenarios that explain a solo ager. As you know, if the solo ager has a power of attorney or has capacity, obviously they would be the person to sign our agreement, because we do have to have someone to sign our agreement before we can, and this would be for anybody, even if you weren't a solo ager, you have to have a capacity or have a spouse, someone who can sign the agreement, and that's just because of legal and liability issues for services. And in that case, with all clients, whether they're a solo ager or they have a spouse and family members or not, we are there to do what they need us to do. So we work in a very concierge way. If that person needs us to take, to start making their medical appointments and doing their medications and putting in the resources, we're doing that. If that person, I mean, I'm working with this, so I'm thinking of one of my clients right now, her children live out of the country and she lives here, and she has somebody, a driver, who she uses to take her to her what she calls non-essential medical appointments. And then I take her to all of her essential medical appointments. So she and I go to the cardiologist, we go to the neurologist, we go to her primary care physician, but then she has her driver take her to the optometrist or take her to the podiatrist, which she can, or her dentist, which in her situation, she feels those are not as important as the others. So we work with them in a way that best fits that individual. With all solo agers or clients with support, we encourage them to get their powers of attorney for healthcare, to get their powers of attorney for finances, to help us help them make a plan. At Aging Focus, I know some of my colleagues across the country as well, because we just talked about this last week, have programs for what we call the healthy older adult who doesn't have the support system or otherwise a solo ager, where they can start to create a relationship with one of us and start to put a plan in place so that we know who they are and what they want. So when they do reach a crisis, when they do reach a situation that they need us more, we're able to just jump right in and get it done. We're not trying to figure everything out about them in a crisis situation. One of my gals right now, she is actually in London, and all she does, she says, "Hey, Rebecca, here's my my travel itinerary for the next 6 months. This is when I want to see you in between and update you on what's happening in my life, if anything's changed." And then she takes off, does her thing, comes back, lets me know. And I'm just kind of a point of contact for her, right? I kind of I just know where she is. A few months ago, she fell and fractured her hip, ended up having to have some surgery. And so I stepped in. We got that all taken care of, got her through rehab, got her back on her feet, literally, and she's off running and traveling again. And then I step out until she needs me again. But I've known her literally for 7 years because she decided to join my Bridges program, have me get to know her. And when something happens, I step in. She got COVID and, I was there to get her medicines, make sure food was being delivered, make sure that she had what she needed in her home. So that she could get through that. That was something we did 2 years ago for her. And so we're in, we're out. So that's a good example of with solo agers, how we work with them. But really with any person that we're working with, we're building our program around their needs. Very, very concierge service. All right, what was the next? I hope I answered that question.
Thank you. Yes. And then can you schedule a meeting with a client just to see if they need an aging care professional in their lives, or does the meeting have
Absolutely.
to be scheduled? Okay.
So this is how I work, and I can only tell you how I work, but and you know, I would say just call somebody. You don't have to call me, but you know, look at that list on there. If there's somebody who just sounds good to you and that's who you want to talk to, we love to talk. So aging life care managers love to talk. So you know, call, do a, you know, let them know what you need, ask them if they do a consultation and how their consultation works in their organization. I can tell you for myself, for Aging Focused, the way that it works is when somebody calls me to inquire about services, I explain what I do. I explain what my structure is. And then if they want me to send them a copy of my contract, I do. But I always tell people it is very difficult, unless it's just unavoidable, to hire somebody over the phone. So if it's someone who maybe lives away, we can schedule a Zoom meeting, because at least you're getting to see what I look like. And, you know, you can, that's the one good thing about COVID, I think, is we started doing more Zoom meetings. And some of us are Zoomed out, but at the same time, it's better than not having any kind of face-to-face time. But what I do is if folks are far away and we need to do a Zoom, we will do it that way. Otherwise, I do a 1-hour consultation in person. If that person signs on to services with us, that 1-hour consultation is free. If that person does not sign on for services with us, then that consultation is at a reduced rate. Because I figure it's a win-win situation. I've used my professional time. I'm going to give you some resources and advice anyway, because that's just the nature of who I am, as are most of my colleagues. So you're going to walk away with some information to move forward if you don't sign on with us. But I've gotten paid for my professional time with you at a reduced rate, and you've gotten an hour of time at a reduced rate. And so it's a win-win in that situation. I'm not sure how some of my colleagues work, but I know that's how we work here. And so I'm happy to do that at any time. So the answer to that question is yes, but just ask how they do it so that you know ahead of time. I see the next question is fee structure. So in San Diego, I can tell you for sure that the fees are anywhere from about $100 to $250 per hour. It depends on the organization, I guess, and what they feel they're worth. So it's really, and again, who are you comfortable with? Again, because I just like everybody, I like to be transparent about my organization. Our fees are $185 an hour, and we charge in 6-minute increments. I bill clients either monthly, every other month, or quarterly based on their preference and how they get their income. And I do take a 10-hour retainer that is paid at the beginning of your services. It's fully refundable, and it's assessed to your final bill, whether that's 1 month from now or that is, you know, 5 years from now or longer. So that's our fee structure at Aging Focused. Everybody works differently, so I would ask whomever you're working with what their fee structure is, how they charge, because that's important too. Is it 6-minute increments or 15-minute increments? Because if you're being charged in 15-minute increments, your bill will definitely be bigger. Nothing else I can say to that. Oh, I think that's it. And then the next question I see in the chat is, will you be put on the POA for healthcare? So we generally are not powers of attorney for healthcare. We're starting to look at, for the solar agers, whether that's a good idea or not. We will always want to make sure that we don't have a conflict of interest when we're the power of attorney for healthcare. and then also a care manager who's charging for services. I think the big question, and I sat at an ethics roundtable at our last conference, is how do we ensure that our consumers are safeguarded from really making sound power of attorney decisions when we're also getting paid. So that's not some of us are already doing that. Not all of us are at this point. I personally am still kind of grappling with how do I do it and make sure that there's safeguards in place. Not that I would ever keep somebody alive just to continue to, bill them. That would be horrible. But how do I put in systems in my organization for safeguards is really, I think, where I'm at with that. What we do is we will be added to your healthcare accounts, and you would sign HIPAA releases because we do need to do things on your behalf. So for example, just previous to this call, I was scheduling appointments for some of my clients, and they always ask, like, what is your relationship to this patient? And I can say I'm their care manager. So in their My Chart accounts, I'm listed as a person that can call. I'm listed as a care manager. Sometimes I'm listed as a caregiver or a friend because care manager isn't always an option to choose. But all my clients have signed HIPAA forms or authorization forms for me or anybody at Aging Focused to get healthcare information for them, because that is what we need to be able to do our jobs. So hopefully I answered that question. Does San Diego have an organization like Avenidas in the Bay Area? I don't know what Avenidas is. So if Gerald, if you'd like to add a little bit of information about that in the chat, I will come back to that question. Do you have a standard fee, for example, for solo agers who sign up early, or is it a fee for service as needed? Thanks for the great. So yes, it's a set fee. It depends how often you decide that you want to engage with us. So at Aging Focus, we have a quarterly option, and we have a twice a year option, biannual option. And those are pre-packaged. And if you pay in advance, there's a slight discount for that. And then if you have a crisis or an emergency and we step in, you step into our hourly rate. And then once we're done with that, you step back out into just the Bridges at Aging Focus, it's called the Bridge program. You step back into the Bridge program rate. And I can send information to Vania on that program, and she can put it in their resource info so that all of you have access to that. I don't know it off the top of my head, and for me to search in my computer right now to find it would take a little bit of time, but I can do that if that would be helpful. All right, next question. Oh, thank you so much. So I got a message. This is the best presentation the Retirement Association has ever had. Thank you. I appreciate that. I do try to work hard and give as much information as I possibly can. Another question, does long-term care insurance cover care management? The answer is generally no. Many long-term care insurance policies state that they have care management services, but it's actually a care manager that works for the long-term care insurance. And I'm going to tell you a secret, their job is really not to get your long-term care going, because long-term care saves money when they don't start a plan. Some of them are helpful, I will say. That I did run into a care manager the other day that was very helpful and helping us, and she was a care manager through the long-term care insurance, and she was extremely helpful in helping us get the services started. So another thing about long-term care insurance is I would highly advise that if you have a long-term care insurance policy, that you really look before you call them and start saying, here's my situation and I want to get started. Don't do this. Call them and say, what are the parameters to get started? Because they take note of everything that you say. And sometimes consumers get themselves into a deep hole with long-term care insurance because they don't know the lingo. And again, long-term care insurance, their job initially is to deny startup because, you know, these policies, especially if it's an older policy, they're, you know, they have lifetime limits. And, you know, if they can save a year, they can save 5 years on that lifetime limit, they've saved money. And that's just the nature of insurance in general. And it's not to say anything bad about them, but that's just how it works. You know, consult with one of us. We do consultations, short-term consultations all the time. You know, I just helped a family recently. All we did was help get their mother placed in memory care, and we were done. We worked with them for 1 month and that was it. I mean, you sign on with us and you're not like indebted to us for life. You can cancel your policy, your services with us at any time. And you can call us and say, hey, you know what, I just need help getting my long-term care insurance going. Is this something that you do and can you help me? And we can often help you do that and show you, you know, help you review your policy, give you the do's and don'ts of what to say when you call, and then work with you there. Just a little long-term care policy situation I had recently is I called with the daughter of my client who has dementia, and that individual spouse who passed away was listed as the primary power of attorney, and long-term care actually asked, and we explained that to them. We're like, you know, we're calling about, you know, my client's saying my mother, and they're saying, yes, but your father's the power of attorney. And she said, but my father is deceased and he's been deceased for 5 years. And the long-term care person actually said to us, well, can he write us a letter to let us know that he's deceased? And I was like, wait, what? And I was like, you mean, do you want the death certificate? Like, because we can send that to you. And they said, well, that'll work. Or can you have your mother send us a letter that you are her power of attorney? We're like, she has dementia and has, you know, been deemed to not have capacity. How is that letter valid? So, you know, you can get in this like circular mess with insurance companies sometimes. And, you know, again, let us do the heavy lifting. Let us help you get there. And, you know, it might cost a little bit of money on the forefront, but in the long run, it's going to be worth it. And there are people, not just care managers, who specialize in long-term care insurance policies, and I'm always happy to give that information too. It's a resource, and just kind of depending what you need, we're there to help. I don't see any other messages in the chat box, and I still don't know what Avenidas is. And didn't see anything in there. So I'm sorry, I can't. Oh, wait, just got a new message. Maybe that says what it is. Oh, you're very welcome. So someone just thanked me for explaining that long-term care information. And Gerald, I guess the person who asked about Avenidas, if you want to email me directly, I'll check with my cohorts up in the Bay Area, and if I can get an answer for you on that, I'll let you know. And I can also let Vania know, for those of you, if it's something that's helpful to our San Diego folks, for sure. Any other questions, complaints, anything? I'll take them all. Oh, you're very welcome. I had another thank you for the presentation message.
Well, thank you so much, Rebecca. This was a wonderful
Absolutely.
presentation, very informative. And then with your permission, we'll post the presentation on our YouTube channel.
Sure.
Yeah, I'm sure several other people who couldn't join us today have several of the same questions.
Great.
So great. Thank you so much, everyone, for joining
You're
us today.
welcome. Thank you, everybody, for attending, and I hope you have a lovely day.
Thank you, Rebecca.